Hello, my name is Mark Gibson, and you're listening to the podcast version of the Teagasc Signpost Series, a weekly webinar that promotes and examines sustainability in Irish farming.
Good morning, and you're very welcome to this morning's Signpost webinar. The webinar is brought to you in association with Dairy Sustainability Ireland, Food Drink Ireland SkillNet, and the NRN. My name is Pat Murphy, and you're very welcome this morning. This morning, I'm delighted to be joined by two guests, and we're looking at that, I suppose, thorny and difficult subject of health and safety on farms. And it's not just a problem here in Ireland, it's a worldwide problem. And I'm delighted to be joined by Dr. Jacquie Cotton from the National Centre for Farmer Health and Safety in Australia, based in Melbourne. You're very welcome to us here this morning. It's 6 o'clock in the evening, so you're ready to start your weekend there.
Yes, absolutely.
You might give us just some background to the work of the centre and your role, if that's okay.
Yes, absolutely. I am a senior lecturer and researcher with the National Centre for Farmer Health. We are a partnership between Deakin University and a local health service here in Hamilton, Western District Health Service. And we have a focus on making a difference to farmers' lives through improving health, wellbeing and safety. And I'll talk to you a little bit about all the things we do.
How big of an issue is it, and how, I suppose, relative to other industries where massive strides have been made in terms of improving health and safety, the level of improvement that we've seen in agriculture has probably been slower. Is there a similar story?
Yes, absolutely. It's a similar story. Agriculture across the nation is overrepresented in terms of fatality and injury rates, particularly compared to other industries such as construction, mining, transport.
Ones that you would expect to be as dangerous.
Mm-hmm.
Yeah. We're also joined by John McNamara, a health and safety specialist with Teagasc. John, again, if you join us here. It's a shared presentation. I think majority from Jacquie and John will be coming in with a number of issues from an Irish perspective at the end of it. Delighted also for our questions to be joined by Francis Blythe, health and safety specialist, again with Teagasc. Without further ado, Jacquie, if you could prepare your presentation, and I'll remind people to use the Q&A to put in questions, and we'll put those to both of you after the presentation.
And thank you again for having me. I'm delighted to be joining you this morning or this evening. For myself, as we mentioned, the National Centre for Farmer Health is located in Hamilton, which is in southeast Australia, in the state of Victoria. Some of you may or may not have visited Victoria in your time, but we are 3 hours southwest of Melbourne. And today I'm going to talk to you about health and safety in Australia, but also touch a little bit on wellbeing and show you where that also fits. So I'll talk to you today a little bit about the National Centre and what our origin and the sorts of issues that are the reason that we exist here in Australia. What are the health, wellbeing and safety needs in Australia? And what are some of the research and extension programs and tools for community that we are creating to try and address some of those issues? And this photo here is a lovely picture, not too far from where I'm located. This is in Horsham, which is about an hour north of where I am, but is fairly representative of some of our inland water bodies in Victoria. So the National Centre for Farmer Health was established in 2008 by Professor Susan Brumby. as I mentioned, we're a partnership between Deakin University and a local health service, Western District Health Service. That makes us reasonably unique, particularly in Australia, in that we're not located in a capital city, and we have a close association in the farming community that we are based, which is the importance of that association with the local health service really has been a driving force to the success of the centre, but more so the engagement with the community that we are working to improve their outcomes. We have a focus on health, safety, health, wellbeing and safety. So none of these are siloed and often intertwined, and our researchers and extension experts often work together across these three areas. You'll often hear us talking about all three rather than each one separately. Our focus population are farmers, farm workers and their families, but also really the agricultural communities that farmers and their families live in. So we know that there are many people in an agricultural community that work closely with farmers day to day. So they are also part of the groups that we want to engage in health, wellbeing and safety. So we cover a number of different, we call them pillars, but we have a focus on education and training. We conduct research, and then translate that often into our education, whether that be postgraduate or undergraduate education, but also the community education we provide. So we are recognised for the resources that we produce, and we have a website that has a number of different fact sheets that are available for not only professionals, but the farming community. It really has a focus on providing ease of access to health, wellbeing and safety information. Business development, a large part of what we do requires considerable collaboration and partnership, and I'll show you shortly some of the partners that we work with, but that is our business development and industry engagement is a really important part of the centre, and sharing the information that we generate. And here's a lovely picture of the current staff. We have a multidisciplinary team ranging from clinicians, and registered nurses, but also, like myself, agricultural scientists and people we have a number of staff with training in both extension and education as well. So I myself have a background in agriculture. I'm not a health professional. I'm an agricultural professional with a background in veterinary parasitology by training, and have been with the centre for 10 years, and have made the switch to the pivot to public health with a focus on farm safety, particularly agrochemical exposure, but more recently farm safety culture, behaviour change, quad bike safety, and safety education. But I am surrounded by a team of people that help us get the job done day to day. So as I mentioned, we we have a focus on health, well-being, and safety, and we don't believe any of these things stand alone, and often have aspects of one or the other that influence each other. So, for example, naturally, safety and health are naturally combined and associated. And that also flows, though, to well-being, and focusing on trying to look at the impact things and aspects like fatigue and mental health have on safety practices, and how safe farmers are when they are under stress. As we all know, farming is a very stressful occupation, and I'll talk a little bit later about some tools that we provide to help circumvent that. But we know that there is a safety, there's an overflow, a positive overflow into safer practices when we also create a mentally safe workplace, but also farmers' personal well-being is also addressed and supported. Here are just some examples of some of the partners that we work with. We are very passionate about engaging with both health partners and agricultural industry. So people and professionals in the health sector need to often better understand the pressures that farmers are under, and the way that some of the nuances of agriculture, and vice versa. Agricultural industry also needs to understand the linkages with health and better integrate health into strategic planning and into extension activities and education. So we strongly believe in incorporating all aspects of the system in our partnerships. So what are some of the issues? Farm safety is obviously quite a significant issue here in Australia. And although Australia is quite vast and agricultural operations can vary quite significantly across the country, the same mechanisms are resulting in high levels of injury and fatality, and that is largely due to vehicles and farm machinery. And this is the case whether you live in far western, northwestern Western Australia or southwest Victoria. Vehicles, quad bikes, and farm machinery, tractors, harvesters, balers are all culprits. They jostle for the top spot as to which cause the largest number of fatalities. Climate variability has quite a significant impact on mental health. Well, both mental health and also hazard exposure. So we often we conduct work, but often give advice in terms of giving farmer context to the issues faced due to climate variability. Social disconnection, you can imagine. In Australia, remoteness is a significant contributor to health, wellbeing and safety issues in our country. And that includes distance from services, but also distance from peers. So rural women's health has become an increasing priority in Australia, which is fantastic, and trying to tackle some of those issues associated with remoteness and access to care are really important in Australian agricultural communities. And also challenging some of those entrenched stereotypes associated with the agrarian lifestyle, and that stereotype that farmers are fit and healthy and or young. The median age of farmers in this country ranges from 53 to 56, depending on the year that the statistics are taken, but it's certainly issues such as body mass index, high cholesterol, high blood pressure, and diabetes are all issues that are particularly based and higher in our farming populations compared to urban populations. To give you a bit of a picture on safety regulation, in Australia, we have a central federal act, but the safety regulation in Australia is governed by the states. And you can see here there are a number of different organisations and states each have their own Work Health and Safety Act. These are reviewed at different times, so they're not all reviewed together. So one of the challenges we face in Australia is centralisation of data. Although Safe Work Australia is currently really our source of truth when it comes to injury and fatality statistics relating to workplace. But certainly one of the challenges we face is, as a nation, having each of the states on the same page when it comes to safety intervention, safety messaging, and safety regulation. So I just wanted to give you a little bit of a picture of how that looks, and the number of, there's an organisation in each state that works closely with state government to regulate safety. Here are some recent statistics relating to fatality rates, and you can see here that agriculture, forestry, and fishing are placed together, and consistently top the charts in this regard. And we've had, thankfully, a slight decrease in these 2021 statistics, but certainly they are still well above our other industries. You can see construction, mining have significantly reduced their rate of fatality. And here you can see vehicle collision in agriculture was the #1 cause of incident across Australia. So one thing we focus on, the thing we focus on at the National Centre is, particularly when engaging farming communities, is the flow-on effect of poor farmer health, whether that be poor mental health or an injury resulting that's resulted on farm. We know that this has a flow-on effect, not only for the individual but also for the community, and the loss that an injured or a death in the community can have on committees, on reduced capacity through volunteer work that we know lots of farmers do, sporting clubs, community groups, a key loss of labour, and we can often see children often stepping up and family members stepping in to assist where a key worker is injured, but also the impact on family having to care for that individual. So just a bit of an overview of some of the health outcomes. So a large proportion overweight or obese, one of the highest incidents of cancers in our rural populations compared to urban. Mortality rates are reasonably high. Alcohol consumption, we know, is in terms of it's the risky alcohol consumption that is higher in farming communities compared to urban populations. Other aspects, so general consumption is reasonably similar, but the risky alcohol consumption is higher in the farming population. And issues like access to GPs and other specialists, we know is a considerable issue in rural communities. However, it's not all bad news. As I mentioned, farmers there's a strong community connectedness in rural communities in Australia, and community participation, and when we talk about people banding together when either an accident happens or as we have this natural disaster impacts farming communities here in Australia reasonably regularly and increasingly regularly, and so that connectedness is a really important aspect to resilience in farming communities. But we know the farm is a complex workplace. Many of our farms in Australia are family owned and operated, but we also have large commercial farms and also family farms that employ staff. But often the family dynamic, you will have multiple people working on that farm or part of that farming family that also work off farm. But we have also children interacting with farms and recreation happening on farms, as well as the farming work itself. And I'm sure you're all very aware of that. So to give you a bit of just an overview of some of the training we provide training at a postgraduate level, but we also provide training and have created resources for teachers to use in classrooms, to particularly agricultural classes, to easily introduce farm safety to those students in a way that is engaging. There was quite a large gap in Australian contextual videos that were engaging for the secondary school children age group, say that 12 to 18-year-old age group. So we have recently developed some resources which I'm happy to share. Our research and innovation covers farm safety, it covers mental health. We have recent work that's been done in looking at climate variability, and presentation to hospitals on high heat days, but particularly looking at the data that is specific to farmers and presentation of farmers, not just rural people. So often the work and the research we do, we will offer a farming context, which is really important. We feel that cultural competence is often really important to a number of different projects that have a rural focus but really need a farmer focus. So here's just a bit of an overview of our farm safety research. And in the middle here, you'll see the framework we try and operate off is the social ecological model, which recognises that farm safety is not just about the individual, but it's about the community. It's about industry, whether that be health or agricultural industry, but mainly agricultural industry, recognising the role they play in influencing farm safety practices and facilitating safe farming. Community, so what are that peer-to-peer interaction and learning within agricultural communities, and of course public policy. So we provide recommendations to both state and federal government bodies in regard to farm safety. And at the end of the day, it is all really trying to reduce injury and fatality in the country. However, we know these are lagging indicators. So what we are working really towards is recognising what are some of the risk factors that we can perhaps try to measure before we're measuring an injury or a fatality. We've recently conducted some work on children on farms, and Jessie Adams has just completed a PhD that included parents in this conversation, a really important part of and gap we have in Australia is knowing really what parents actually think about farm safety and what are some of the barriers and enablers to creating a safe environment on farm. And we know there are lots of challenges with being a parent, managing childcare and supervision on farm, managing whilst also trying to run the farm itself and conduct tasks on farm with little people around. Our service delivery outside, so lots of the research we do feeds into our service delivery. So our registered nurses conduct clinics, we conduct health checks at field days with farmers, collecting information on cholesterol, blood pressure, those health indicators that often people will put off going to their doctor because of either access or waiting times. Many farmers know that we will be at a field day and will often revisit us year on, year out, and have their blood pressure checked every year, which is fantastic, and that's what we want. But we also conduct clinics which are longer, they're 90 minutes. They incorporate agrochemical exposure testing, but also have a stronger follow-up and a stronger connection with the nurse who's actually conducting that service. And that flows through just the health coaching we're able to provide. Utilising and partnering with other organisations that also really want to help provide a larger farming context in the way that they engage with farmers and the conversations that they have with farmers in the clinic. And here's just a couple of pictures of us in action. So our community engagement, we have a number of, as I mentioned, our website. You're all welcome to have a look and connect with us. We have a newsletter. If you want to know more about Australian health, wellbeing and safety, absolutely join our e-news list. But we have a number of fact sheets that help shed some light on a number of different topics, and we often partner with industry in the relevant areas to review those and make sure that they are hitting the mark, so to speak. We have a set of media guidelines. We strongly believe the language that we use in the media to report on incidents, but also to depict agriculture can have a real influence on safety culture. So we've put together a set of guidelines for use and for producers and print media to utilise and refer to. And there are a couple of these. These are increasing. Organisations in Australia are starting to, not only ours, but there are other organisations that also have media guidelines. It's such an important part of the broader safety culture story. More recently, as I mentioned, resilience has been an important part of connecting with communities, and a recent project commissioned by the state government in Victoria has been building farm spirit, and this has been about generating positive stories from farmers themselves who have experienced adversity through natural disaster or just the general pressures and stress of farming. Sharing those stories has been a really important project, and we've just finished a legacy piece which I will share with Pat and the team, so everybody can hear some of those stories from Australian farmers. You might find it very interesting. We've recently had a royal commission here in Victoria into Victoria's mental health system, and contributed to that to give a perspective on farming communities and the needs that we see for farming communities in Victoria. And that's resulted in two new digital service delivery initiatives that we are currently working on, which we'll be really pleased to provide for farmers. As I mentioned, we have AgriSafe clinics, but we've also, COVID meant we had to pivot the way that we engage with farmers we engage farmers in their health and wellbeing. And so we developed Farmer Hat, which effectively allows farmers, and beyond COVID, allows farmers to benchmark their health. We know they benchmark lots of areas of their production and productivity. So this is a mechanism by which they can keep track of some of those health indicators and some of those safety behaviours. Another recent toolkit is a steering straight program, which allows farmers to identify before they are experiencing poor mental health, identify what sort of plan they can be putting in place in the event that they do really start to experience stress that may lead to broader mental health issues. Really start to put together a bit of an action plan on how to help themselves get through it and build resilience in that space. We provide access to online psychology services. This is a recent, again, COVID has required us to change the way that we engage and provide options to farmers that help to circumvent that tyranny of distance. But one thing that is important about our online psychology is that we have helped train particular psychologists on this platform in farmer health. So farmers can choose psychologists that have been trained in farmer health and wellbeing. We also have a PDF that is very popular, and we encourage farmers to share this, and organisations to share our Managing Stress on the Farm booklet. This is also available via PDF, and it's in an Australian context, but I encourage you all to also have a look, because there's some really useful ways that people can help share this document with anybody that they might be worried about. We particularly recommend agricultural advisors have this on hand in case there is anybody that they are working closely with that they're a little bit worried about but don't quite know how to talk to them about that issue. But it's a way we can be pointing people in the right direction. We have a podcast called Campfire. I encourage you all to have a look. But this has come out of a project that was specifically designed to address mental well-being in the workplace. So again, we have WorkSafe Victoria really amalgamating two key areas, that is mental health and safety. The two aren't separate. So as I said, sign up to our e-news. I absolutely recommend it. So who do we reach? We try and reach farmers. We reach community organisations and health professionals at the moment. We engage with policymakers. A number of our staff, including myself, are on reference groups and committees that allow us to bring farmer health into the conversation so it's not forgotten about. But also students, we are training the next generation of researchers and also professionals that are working directly with farming communities. Who do we want to increase our reach? We want to, and we are really focused on increasing our engagement with trusted advisors and helping them to recognise their role in health, wellbeing and safety, not only for themselves as members of farming communities and sometimes farmers themselves, but also what is their role as a trusted person in a farmer's life. What is that they are key influencers in decision making around not only the business that they are working with, but also safety and wellbeing practice. So we're working to engage them a bit more. Teachers and educators, as I mentioned, trying to make it easy to talk about farm safety and health literacy in a farming and agricultural context in the classroom. And also farm children and parents. We really look forward to having an increased focus on these areas. So I'll finish up by what the evidence we have, and we collect from lots of different, as you could see, where we cover lots of different areas. But the thing that is common is that personal connection is essential. There needs to be a focus on prevention rather than looking necessarily just at what are our lag indicators, the things that happen after, that's already happened before we know about it. So what we want to do is prevent these things before they become numbers. The language we use when we're talking and engaging with farmers, whether particularly in a health context, is really important. One size won't fit all. Not all farmers are the same. There's nuances in terms of location, enterprise type, family structure, generational factors. There are many different. There's a variety of different types of farming. Limited downtime, recognising that farmers don't have a lot of time. So when we are engaging with farmers, recognising that and getting to the point. Local matters, people who understand the community and their needs is a really important factor in success. And that again leads into personalisation, helping engage and encourage farmers to talk to their peers in terms of whether it's getting a health check or buying a respirator. That personal engagement leads to word of mouth. And again, building on existing networks. and resources and knowledge, building on knowledge within the community, but also building on people and organisations that are in a community, because we are in Hamilton, but we need to know more about areas in Queensland or areas in Western Australia. So the connection we have and the partnerships we have with local organisations is really important. And finally, we know farmers are interested in their health, wellbeing and safety. They're interested in their blood pressure. They're interested in their chemical exposure. But when the context is right. So you don't know what you don't know, but what we want to do is get the context right, so people realise that they need to know about health, wellbeing and safety. I will leave it there and I'll hand over to John, and we'll have open to, I'm sure some of you will have some questions. It was a very nutshell presentation of health, wellbeing and safety in Australia.
Okay, thanks for that.
Thank you.
I suppose what we're seeing there is a huge degree of similarity with the issues that I suppose we face here and some of the attempts we're making to deal with them. John, if you are happy to come in there and just remind people.
Let's see, we're talking about sustainability, and it's goal 3 of the UN goals is to improve health and well-being, and I think Jacquie, in her outstanding presentation, has outlined the benefits of both health and safety, and that. And I'm delighted to hear that Jacquie mentioned health. It's an issue we've pushed as well, and I think health and safety are integrated. Okay, I'm delighted to say we have an MOU in place with the National Centre in Australia. I recall I met Professor Susan Brumley maybe in Canada in about 2010, and we've been working together ever since. I think it's clear. I think from Jacquie's presentation, like that, we influence each other in some ways, and that. No, I think, it's how to gain adoption is the challenge that we all face, in, widely dispersed and largely self-employed or SME type, family enterprises. And that. Now, what I want to just talk briefly, and I want to leave time for questions, is, our current projects and an overview of, current farmer safety behaviours. Right, we have an abundance of research going on. Dr. David Meredith is the principal investigator for this. Teagasc's strategic goal 1 is to improve standards of living and well-being, right? So we've projects in health and safety, in health and in well-being. We've a Department of Agriculture, Be Safe. We've a European Horizons project, Safe Habitats. In health, Dr. Diana Van Doorn has just finished her PhD on cardiovascular health. And, we're very strong on our research on well-being, so farmer isolation, social sustainability, and on firm ground, which is a signpost training for agricultural advisors on dealing with health of farmers. No, we publish everything. I put up 2 reports of the cardiovascular health study and of the Engage project. But, we have a lot of papers published in recent years. So if anyone wants more information, it's available, But as I said, adoption is the issue that we want to address. Now, Dr. Mohammed Arezi, who's a research officer with the, Safe Habitats project, we're publishing this paper currently, has done a study and, using a vignette approach, has found that basically 26% of farmers adopt safe behaviours. In other words, 57% do not. Now, there's a big gap. The greens, the top lines there, from about a scale of about 4 up, they're the people adopting safe behaviours. But then there's a group in the middle, 64 farmers, in this study out of, I think it's 307, that are neutral, but there's, a big number of farmers there, 137 and 82, who are below a score of 2, related to unsafe behaviours. So we've made some progress, but we've a long way to go. Now, the issue is this, that, attitude is pretty positive, and intention is positive, but the behaviour is lagging, and past behaviours, risk perception, good farmer identity, and perceived behavioural control. They're all in the, in the yellow or, line, and social norms, which is a huge issue, they're also in the yellow band area. So we have a lot of work that can be done. Right, I'll just throw up the theory of planned behaviour. It's the prominent theory in voluntary adoption, and this is an Irish study supported, by the HSA. And just to describe it, attitudes, social norms, what your peers think what you think your peers think of you, and perceived behavioural control, how straightforward you think it is to do something. Those 3 things drive intention, and intention drives behaviour. Now, the key thing I want to point out in this study is that the subjective norm to intention factor is 0.6. Which is very high by international standards. 0.2 is the normal kind of measure. So that really means that in Ireland, farmers are very influenced by their peers. And I think that's an area that we need to work on more. Another study related to stress and injury. Firstly, the study, and this is by Emilia Fury in UG back a number of years ago, but still very relevant. Farm stress due to workload or poor health and safety conditions or financial stress, but we were looking at does stress influence injury expectations? And the short answer is it does. But stress also affects mental distress, and that affects depression and anxiety and that. Now, the relative good news is that social support, again, these are the maroon diagrams, they're negative if you look at the scores, but social support is very positive to mental distress. So again, people working in groups and in communities is hugely important for mental distress, and of course this can also lead to injury expectation. Right, just to finish. We have an international conference. I have the information up on the screen, and it's taking place on the 23rd to 25th of August. It's taking place in our Research and Innovation Centre at Grange. There's people coming from all over the world. There will be a representative from the Australian National Centre there. Now, there are a limited number of places available for persons to attend, and the email address to contact is there. Otherwise, thank you very much, and I look forward to discussion and questions.
Okay, thank you very much, John. You might stop sharing there, and remind you then to put your questions into the questions and answers tab. I suppose, Jacquie, just a couple of quick questions. I suppose we're seeing a certain degree of change in the farm labour force here, and I suspect it's not that dissimilar, where an increased reliance probably on migrant workers and short-term workers. And I'm assuming that's posing additional challenges in relation to health and safety and practices in relation to working with that particular contingent.
Yep, absolutely. It's a real it's a policy priority at the policy level. Is making sure that seasonal workers are included, and safety messages are accessible by people and are available in a number of different languages, encouraging workplaces who are employing seasonal workers or called workers, with the language diversity, that their safety messaging is being accessed and it is being put in front of those workers. But we know it's a challenge being faced by a number of different enterprise types.
I suppose one other thing that often strikes me that I suppose there's in construction and in other businesses, there's a whole business community has built up around the health and safety issue. Whereas, am I right in saying, by and large, it's been left to public services to provide the same service for farmers? Is that something that's likely to continue, or is there a possibility of a professionalization of some of the responsibility in that area?
I think just due to the nature of the farming business in not only here but internationally, certainly in Western countries, I think there will continue to be a lot of emphasis placed on the communities of the individuals who are farming, as well as the individual. I don't honestly see that changing. What we hope will change is that the priority of in terms of health facilities, for example, that are available to those farming communities and within those farming communities are as state of the art as urban communities have access to. But workforce is also an issue, whether it be from a safety perspective and managing regulation of work health and safety, or whether it be providing health professionals who are trained and willing to live in rural and regional areas. That continues to be a challenge.
And I suppose just a final question before I hand over to Francis. The degree to which the initiative around health and safety is driven by legal requirements as opposed to voluntary. Is it in Australia, is it primarily pushing a legal requirement for health and safety compliance, or is it more about trying to get messaging out there to try and get people to engage voluntarily?
A little bit of a mixture. So recently, certainly in Victoria, where we are based, there's been, so this is where the different states in Australia have different focuses and priorities when it comes to safety, but certainly in Victoria, there's been a large government priority towards safety. But what that has meant is that there's been a farmer organisation in particular, the Farmers Federation, who developed a program called Making Our Farms Safer that actually provided, the manpower it's not very big in terms of the number of farms, but what it did is provide people that can consult in health and safety on farm and try and bridge that gap between providing information and engagement and training in safety practices and the legal obligations and understanding of the the legal obligations that farmers actually have, but aren't necessarily regulated or policed.
A number of questions coming in there.
Yes, Pat, lots of questions, and thank you to everybody that has put in their questions. I have a few, and I know we haven't much time, Pat, so Jacquie, you might be just brief with your answers to these.
Sure thing.
The first question that I've come through there is, you talked a lot about, you know, the health checks that you've done and large amounts of great work in that particular area. One person is asking about the agri-chemical exposure element of it. What tests do you try to do, or how do you handle that in relation to those tests, those interventions?
Mm-hmm. We can test for cholinesterase, which is related to organophosphate exposure. What that does is create a conversation about other chemicals that farmers might be exposed to. We can then direct to, if someone is particularly worried, we direct to the GP, who might be able to ask for tests for a larger scale, a broader range of tests. So we have a bit of a pathway to pointing people towards more broader chemical residue testing.
That's kind of a follow-on there in relation to, let's say, you said you go to the events or the farm days. They're brought back sometimes into more comprehensive assessments for some people that need them. Is that's the process, is it?
They can be, or they will choose the farmer, if they're in an area that has an AgriSafe clinic, they may continue instead of to see us between field days, or if they'd like to have a longer, more thorough conversation.
Brilliant. You also talked a lot about, you know, the digital and virtual, and I suppose COVID has brought that along. How does that relate to the need for personal engagement when dealing with health and well-being and safety issues? I suppose the connection, this person is asking really about the connection, and is there a loss of connection when you go online? How do you deal with that?
Yes, there can be. We try to deal with that through making sure the person on the other end of the line uses the correct language, understands the pressure and stress and the farming environment. But absolutely, it's a challenge to try and to engage people in those online activities. It's challenging. We don't quite have the answer for it yet.
Pat, have we time for one more?
One more, yeah.
One more. So the last one really is associated with sheep farming and Victoria, and the emphasis here is on scrambler bikes, and you're on them for a large number of hours and maybe up to 10,000 sheep. Is that something like, it's not that something, how do you handle that, or what messages are you trying to give out in relation to that?
Scrambler bikes.
Yes.
Quad
Motorbike,
bikes?
scrambler, quad. Well, the quad bike are for the two-wheel ones, the dirt bikes. Sorry,
2 wheels? Yeah. No,
they've mentioned scrambler here, but the 2-wheel bikes.
So my apologies. Yeah, absolutely. Vibrate, and it's certainly something that we provide information on about vibration and that and how that can impact the body, but also, and that relates to tractors as well. But also ensuring that and certainly we've been working with our health department in campaigns that encourage the use of proper gear, not forgetting helmets but helmets in particular. But heat can also be an issue associated with long periods of time on the motorbike in the helmet. There's many compromises that farmers need to make in different areas of the country in relation to that.
Okay, we're going to have to call it there. It's been a quick hour. Listen, and I'd just like to say thank you very much for joining us and giving of what is now your free time. I think you're past the end of the working day in Victoria. So thanks very much for joining us and giving us your time and your insights. And I suppose one of the messages is that a lot, while there might be some differences, there's an awful lot the same, and we have an awful lot of common challenges and a lot of work to do in this area. John, thank you very much for your insight into some of the work that's going on. Appreciate it, and we'll have you back again because this is an enduring topic. So thanks as well to Francis. Next Friday, we're going to be joined by Noel Meehan and Fran Igo, and as you may have seen in press releases, there's just been announced a 60 million fund to support actions for water quality in a large EIP. I suppose this is something that has been identified as in relation to the work of the ASSA program and other programs, that where there's voluntary actions being taken on by farmers, that if we want to get a higher degree of uptake of actions, we need to provide funding. And the two departments, Department of Agriculture and Food and the Marine, and the Department of Heritage, Housing and Local Government, have come together to put together this fund supported by the EU, and it's now going into place in an EIP led by LawPro. So Noel and Fran will be talking about that next week. And with that, we'll leave you, say thanks to Yvonne Marr for all her support, and we'll see you again next week. Thank you.
You've been listening to the podcast version of the Teagasc Signpost Series, the weekly webinar that promotes and examines sustainability in Irish farming. Don't forget to join us live every Friday morning for our latest webinar. For more, visit teagasc.ie. And you can also rate, review and subscribe to the Signpost Series on Apple Podcasts, Spotify, or wherever you get your podcasts from. I'm Mark Gibson, and thanks for listening.